Earlier today, a coalition of doctors and medical organizations announced the launch of the Women's Healthcare Declaration, which advances the truth about dignified health care for women, especially surrounding pregnancy. Now, this declaration calls for patients to receive accurate information regarding abortion and urged medical leaders, medical associations, and agencies to communicate accurately about pregnancy complications, and state laws. There's a lot of misinformation being pushed out by abortion supporters. They're trying to confuse and muddle the conversation, the discussion, and the effect is that women are making poor choices. I mean, in recent weeks, we've seen the left campaign on lies regarding complications from chemical abortions, and this declaration seeks to restore the medical standard for care for pregnant women. Notice I said pregnant women, not pregnant persons. Joining me now to discuss this is Dr. Christina Francis, Chief Executive Officer of the American Association of Pro-Life Obstetricians and Gynecologists. Dr. Francis, welcome back to Washington Watch.
Thank you so much for having me, Tony. It's great to be here.
So tell us about the event that took place today and why all of these doctors and organizations felt it necessary.
Absolutely. So APLOG, the organization that I lead, joined 11 other medical organizations as well as individual physicians to launch the Women's Healthcare Declaration, as you stated. And we felt that this was really important, especially right now, for a few reasons. One is the inaccurate information, as you alluded to, that women and the public are receiving about laws that have been enacted in states that are meant to protect the citizens of that state, pro-life laws. But, there's a lot of information going around that women can't receive life-saving medical care when they need it because of these laws, and that simply is not true. OBGYNs like me across the country in every state are still able to treat miscarriage, ectopic pregnancy, and other pregnancy complications. We also wanted to convey the true dangers associated with the abortion drugs. These drugs are very high risk. They have a higher complication rate than do surgical abortions, and women are being lied to and told that they're as safe as Tylenol or ibuprofen. And so we're calling for the FDA to reinstate strict guidelines surrounding these drugs to at least improve safety for women. Of course, we know that these drugs are never safe for preborn children. And the other thing that we wanted to state very clearly is that induced abortion, which intends the death of our fetal patient, is not healthcare, and pregnancy is not a disease, and that in fact, life-affirming healthcare is the better way for our patients.
I think that is so important, Dr. Francis, because they've hijacked the language, and they're talking about abortion being healthcare and reproductive freedom. I mean, the travesty here in the misinformation that's being put out there, including on the chemical abortions. There have been women who have lost their lives because of complications related to the chemical abortions, and you have politicians pointing to laws in particular states saying that those laws are responsible, when in fact it was the danger of this chemical abortion drug and the misinformation being put out there by pro-abortion supporters.
Absolutely. As you stated, we recently learned of the tragic deaths of two women in Georgia, Amber Thurman and Candy Miller. And of course, pro-abortion politicians and abortion advocates are trying to blame this on Georgia's abortion law, when nothing could be further from the truth. First of all, they died because they took the high-risk abortion drugs, plain and simple. Georgia's law had nothing to do with that, and Georgia's law actually would have allowed physicians to intervene and take care of them. But because of inaccurate information, we know that at least Candy Miller delayed seeking help because she was worried she would be prosecuted, when that's not, in fact, the case.
How can our viewers and listeners help get this information, this declaration out, so that it can clarify this misinformation or counter this misinformation that's been put out there, that it's really a matter of life and death?
Absolutely it is. And it's so important that everyone get involved to ensure that women and the general public have correct information, not only as they go to vote at the ballot box, but also beyond that as well. So people can go to the website, womenshealthmatters.org, If they are medical professionals, I encourage them to sign on to the declaration, to join us in stating that induced abortion is not healthcare and that our patients deserve better. But also, even for people who are not medical in any way, they can sign as a supporter of the declaration and also share this website so that we get this information out there. It's so important that people, as you said, have accurate information and understand that the vast majority of OBGYNs practice actually consistent with these laws. They don't do induced abortions. So I encourage people to share this website. Also, if you're having conversations with your friends or your family about abortion, and they maybe say, well, you're not a doctor, how would you know? Well, you have a great resource now that you can send them to tell them what thousands and thousands of doctors are saying, which is that induced abortion is not health care and life-affirming care is actually what helps our patients the most.
Women's Healthcare Matters. Women'sHealthCareMatters.com. Or is it .org or .com?
Women'sHealthMatters.org.
.org. And so I encourage you to go sign that. If you're a medical professional, sign it. If you're just a listener, viewer, sign it as well and share it with your friends. Dr. Francis, thank you so much for being here today, and thank you for stepping out and leading this effort to bring the truth to this policy debate that is taking place across our country.
Absolutely. Thank you so much for having me on.